So good morning everyone. So here I am in front of you with another session of FMG image based questions. So I have selected some more images, and all these images are actually uh, all subject mixed random images, right? So the very first question goes like this: there is a MRI scan and we have to identify what is the condition which is shown in the uh, MRI image. Now I'm just trying to highlight the points based on which you can make out your answer for a given image based question in the exam, right? So if we look at this MRI image here, we can see that obviously the vertebral region has been shown here. Okay, so these are vertebral bodies. Clear? So these are vertebral body, right? This is one more vertebral body, this is vertebral body, right? This is vertebral body, this is vertebral body, like this. Okay, so these are vertebral bodies. Now in between the vertebral bodies we have the intervertebral disc. So the black shadow which you are seeing here, this is all vertebral disc. Okay, so intervertebral disc. Again, this black shadow is all intervertebral disc, right? So this is also intervertebral disc again, and then here it is something like this. So this is all intervertebral disc. Fine. Now what you need to look here, now you will see that there is some sort of damage to this vertebral body, right? Look here to this vertebral body, because if you compare it with the vertebral bodies above, these are all normal. Clear? So it means this one is affected, right? You can see the outline of this vertebral body and it is damaged, something like this. So it suggests that this vertebral body is damaged. Clear? This one is damaged. Compare it with the other, this is normal. So compare the heights. Okay, so that way you can say that there is some pathology in this vertebral body. And what is more important here in this particular MRI, you can see that there is some collection in or some shadow on the either side of the vertebral bodies, right? So this is some collection here, this is some collection here. So there are some certain shadows on the either sides of the vertebral body, and this is actually the cold abscess. Clear? So this shadow is actually paravertebral cold abscess. So paravertebral cold abscess. Now when I say the word para means by the side, right? So para means by the side. So here you can see the abscess, it is lying by the side of the vertebral column, right? Here also this is all cold abscess. Clear? So the moment you find the word cold abscess, you have to think of only one pathology, and that is tuberculosis. Clear? So cold abscess has to be associated with tuberculosis, and since it is affecting the vertebral column, so the answer will come out to be tuberculosis of spine, right? So this is an MRI of tuberculosis of spine, and the important finding is of course the cold abscess and the vertebral body damage, right? So this is an MRI of TB spine. Now moving forward to another question, and here you will see some nomenclature has been done, like P is there, then N is there. So P is actually proton and N is the neutron, and there is one more, that is electron. Clear? So we can see P here, right? So this is P, then this is E, and this is N. Now what I want to show you here is that if you look here, the number of protons is actually known as atomic number, right? So the number of proton is atomic number, and if you add protons plus neutrons, it becomes atomic weight or atomic mass. Clear? So there are two definitions: atomic number, which is equal to number of proton, and atomic weight or atomic mass, which is the number of proton plus neutrons. Now in this particular image, you can see that out of these three forms, atomic number is equal in all. So atomic number is same in all, but and the atomic number of all the three is 1. So 1 in all the three. Clear? So because atomic number is what? Atomic number is proton. So you can see there is a single proton in all the three forms. Now when we talk about atomic weight, the atomic weight is different in all the three. So if you see, for the first it is 1, for the second it is 2 because 1 plus 1, and for the third it is 1, 2, 3. So 3. So what we can see here, in these three forms, atomic number is same, but they have different atomic weight, and such substances are known as isotopes. Clear? So these are actually isotopes which have the same atomic number, that is the same number of protons, but they have different atomic weight because they have different number of neutrons, right? So this is actually just a theoretical concept. Then moving forward, like the question is about substance which is commonly used in such a scan. To answer this question, firstly you have to identify the scan or identify the investigation, then only you can think of the perfect answer, right? So if you see here, we are looking mostly in the skeletal system. We are studying the skeletal system mostly. So you can see the skull, you can see the thoracic cage, then vertebral column, pelvis, femur, okay, then upper limb bones. So we are studying the skeletal framework. So we are studying skeletal framework, and this investigation is actually known as bone scan. Clear? So this is bone scan. We are studying the bones, and this is actually done to study metastasis to bone. There might be tumor somewhere, and they will send the tumor cells to the skeletal region. So we study metastasis, like which part of the skeletal system is having activity. So whatever the black shadows you are seeing here, right? So whatever the black areas you are seeing here, these are all sites of metastasis, and they suggest that there is increased metabolic activity here. So you can see there is metastasis almost everywhere in the vertebral column, ribs, pelvis, okay. So this is to look for metastasis, and what we use here, we use one radioactive substance, and that is technetium. Clear? So this is known as technetium scan, right? So for most of the nuclear scans, we prefer using technetium. Clear? So this is a bone scan, and it employs technetium, and this is done to check metastasis. Then moving forward, now what is this procedure which is shown here? Now this is actually a type of radiotherapy, right? So it is a type of radiotherapy, and I think all of you must be knowing that what is radiotherapy. We give radiation, and this is specially given to tumors or cancers. Now in this given image you can say that yes, this is a case of carcinoma breast, right? So there is cancer of breast, and what we have done, we have implanted the rods within the breast tissue so as to deliver the radiation to the tumor. So this type of this mode of radiotherapy is known as brachytherapy, right? So this is known as brachytherapy, and it means that the source of radiation is kept closer to the tumor, right? So this is closer to the tumor, and this form is actually known as interstitial brachytherapy, right? So the exact answer will be interstitial brachytherapy, and we have implanted the rods and through which the radioactive substance will be delivered to the tumor area, right? So this is brachytherapy. Then moving forward, identify the fracture. Now to identify a fracture, firstly you have to identify the bones which are shown in the fracture here. Now you can see there are two bones, so only there are two areas where we can have two bones together in one at one side. One is of course forearm and second is leg. So this is actually forearm, and here you can see this is the head of radius. Clear? So this is the head of radius. Then you can see this is the olecranon process of ulna. Clear? So it is very easy to identify which area is this. So this is olecranon process of ulna. Obviously this will be humerus, right? And then wrist and carpal bones lower down. Now what you can see here, there is fracture of, right? So there is fracture of ulna. Clear? We can see here that the ulna has fractured. So this is the proximal fragment, and this is the distal fragment. Clear? So there is fracture of ulna. So one thing we can write here, there is fracture of ulna, and which area? This is proximal third, right? So this is ulna, proximal third. If we divide it into three parts, so somewhere like this is distal third, this is middle third, and it is at the level of proximal third. Apart from this, what we can see that the head of radius has moved away from the proximal part of ulna. So it means there is dislocation of superior radioulnar joint. Clear? So you have noticed two things. One is there is fracture of ulna in proximal third, and secondly you have seen that there is dislocation of superior radioulnar joint. Now if you find these two entities together, the answer will be known as Monteggia fracture dislocation. Clear? So this is Monteggia fracture dislocation. So this is how you have to identify it. Yes, Xavier, you are absolutely right. This is Monteggia fracture dislocation, right? Now moving forward to another question. Now here there is a patient who has an accident, and now he is presenting with breathlessness and tachycardia, and then chest X-ray is shown. Now here breathlessness means, yes, obviously there is some pulmonary pathology, right? So this is some pulmonary injury, you can say. And tachycardia suggests that there might be hypotension. When the blood pressure is less, body responds by increasing heart rate. So hypotension has resulted in tachycardia. So there is some injury which is resulting in lung pathology and also hypotension. Now what we can see in the X-ray here. To understand the X-ray, you have to notice 2-3 things. One of the important thing is, if you see, there is a black shadow, black tubular shadow like this, right? So this is actually the tracheal shadow. Normally the trachea should be in midline. So normally trachea should be in midline. Now how we can say that it is trachea and nothing else? Because air will always create a dark, or you can say black shadow on X-ray. Remember this, right? So air will always appear blacker, and that is usually known as, in radiological terms we call it radiolucent in radiological terms. So again you can see here, this is all black. So this is all air in the atmosphere outside the human body. So this is how you can say that this is air. Now coming back to the lung proper. Now what you can see here, now this is the normal lung shadow. But if you look here, this is very dark here. Clear? So you can see this is so much of dark. So it means this area is rich in air. So it means there is presence of air within the pleural cavity, and that condition is known as pneumothorax. Clear? The word pneumo means air, and thorax here is actually the pleural cavity. So there is pneumothorax. It means there is so much of air within the pleural cavity. It is giving all dark black impression, and this is actually radiolucency in radiological terms. Now tracheal shift plus pneumothorax, you have to answer it as tension pneumothorax. Clear? So this is how you will reach up to your answer. This is tension pneumothorax. Air, that is all black impression in the pleural cavity, and shift of trachea. Now again in trachea there is air, so we will see a black shadow that is going downward. So again you can see this is all tracheal air impression. Clear? So this is how this is Xavier, this is actually traumatic, right? So there is collection of air within the pleural cavity, and that is pushing the trachea to the opposite side, and this is actually known as mediastinal shift. Okay, so this particular thing is known as mediastinal shift, right? So this is mediastinal shift. The trachea is pushed towards opposite side. So please remember this: pneumothorax plus tracheal shift to opposite side. Right, so you can just write opposite side. So if you have these 2 points, the diagnosis has to be tension pneumothorax. Okay, great gentlemen. Right, so this is how you can apply a basic concept, and I am very sure you will be never wrong in your answer. So even in this session I am just trying to decode the images. I just want you to look at the images first, try to understand what actually is being shown there, and maybe you need not look at the options. You can straight away make your answer. Okay, yeah, this is like this. Great. Then moving forward. Now a patient presented with hematemesis and following a binge drinking of course, alcohol in a party. So he has taken a lot of alcohol, and after that he presented with hemat is blood, emesis is vomiting. So there is vomiting of blood after taking lot of alcohol in a party. Very good savior. Yes, this is Mallory tear. Now, so two important points: alcohol drinking, hematomesis. Straight away you can make your answer as Mallory Weiss tear. Clear? So I am also highlighting the important points which has to be there in the stem of the question, right? So you have to not simply based on alcohol drinking you can go for Mallory tear. There has to be an associated hematomesis. Clear? So this is Mallory Weiss tear and how it actually looks if we do endoscopy. So this is a endoscopic image. Clear? So this is endoscopy image. We will pass a tube with a camera and we will look the interior of the gut. Now this part is gastroesophageal junction. Okay, so this is gastroesophageal junction, which is also known as lower esophageal sphincter. Clear? So this is also known as lower esophageal sphincter, and you can clearly see that it is closed, right? So it is some narrowed down because that prevents the reflux of gastric content into the lower part of esophagus. Anyway, now what we are seeing here, now the lumen, we can see here a vertical tear, right? And we can see the bleeding also. So this is the reason of coughing or vomiting out of blood, right? So the characteristic lesion here is partial vertical tear. Clear? So this is the classical description of the lesion. Partial means it is not involving the entire thickness of the gut. Vertical, you can see it is lying in a vertical plane, and this is a tear leading to hematomesis, right? So very easy to identify, right? I am not going more into details of Mallory Weiss tear. I just want you to make the answer as such. Now moving forward to next question. A female presented with villous vomiting. Okay, so villous vomiting, and there is history of constipation and the X-ray is shown. Now bilious means bile, right? So bilious vomiting means there is bile in vomitus. So whatever the substance she is vomiting out, it is containing bile. Now when you have this word, it suggests what? So for that you need to understand a little bit of anatomy. So suppose if this is the anatomy of duodenum. Clear? So in the second part of duodenum, this is of course the second part. So in the second part of the duodenum, there is opening of the common bile duct, right? So the common bile duct is coming here. Of course it is joining with the main pancreatic duct. So this is the common bile duct and it contains bile. Clear? So it is in the second part of duodenum at the ampulla of Vater. Now if there is bile in the vomitus, it means obstruction is somewhere distal. Then only when the vomitus will come, it will include bile. Clear? So this means obstruction distal to second part of duodenum. Clear? So this is the point here. Now if I say non-bilious vomiting, it means there is no bile. So it means the obstruction is somewhere proximal, and therefore when the vomiting will occur, it will not contain bile at all. So this is how we understand the the importance of the word bilious or non-bilious. Gentlemen, the PDFs, yeah, you need to download my app, right? So there is one app which you need to download first, that is My Institute, right? So download this, and the org code is KVG, right? So that will take you to my app, and then you will get all these PDFs there, right? Anyway, coming back to the class. So if there is non-bilious vomiting, it means no bile in vomitus. It suggests obstruction proximal or before the second part of duodenum, right? So one thing is clear, since bile is here, so the obstruction will be distal to second part of duodenum. And this classical X-ray, now I just told you that whenever you see a black shadow, that is all air. So that you have to keep in mind. Whenever you see a black shadow on X-ray, gentlemen, the app is with some different name, and it is not with Dr. Kamal KV group. You need to download My Institute app first. So the name is little different. That is My Institute, right? Okay, no problem. I'll share the method in the description box as well. Thank you, gentlemen. Right. So I'm sorry. So anyway, if you see a black shadow, again you can see here, this is all air in lungs, right? This is all air in lungs. So when you see air, it suggests, when you see a black shadow, this is all air, right? So what you can see, this is air here, right? This is all air, clear? So this is all air in bowel. Now what is more important to understand here, the lower margin of the air is a straight line, right? So the lower margin of the air is almost a straight line everywhere, clear? So this is one more important finding which you can notice here. So black is all air, right? And this is all air, and below that black line you can see some white shadow. This is actually fluid, right? So the white shadow beneath that black shadow is all fluid. So we call it air fluid levels, right? So what we'll write here, multiple air fluid levels, right? So you can see plenty of air fluid levels, and in a setting of bilious vomiting, X-ray abdomen showing multiple air fluid levels, straight away your answer will be small bowel obstruction, clear? So this is how you have to answer this particular question. There are many similar things which can be seen at other places, but I am not going into those discussions because that will dilute the core concept of the question. So I just want you to remember this much for this condition, right? So this is how you will identify an abdominal X-ray of small bowel obstruction, and the patient clinically will come with bilious vomiting, of course. Now moving to another question. Now what is shown here? Now if you look here, this is the cervical canal, okay? So this is the cervical canal, right? Internal and external cervical openings, and on the top of that, this red structure is all placenta, clear? So this is all placenta, something like this, and then this is of course the umbilical cord, clear? So this is the umbilical cord, and this is the placenta. Now what I want to show you here is that this placental tissue is overlying the cervical opening, right? So placenta is overlying, you can say, cervical opening, and this condition can at times results in, very good Savior, very good, this condition can at times result in bleeding, that is known as antepartum hemorrhage, right? So this condition can result in antepartum hemorrhage. Anti means before, partum means delivery. So a pregnant lady can have bleeding just because of this abnormal location of the placenta, right? So, and yes, this condition is placenta previa, right? So this is placenta previa, where the placenta is overlying the cervical os or cervical canal, and the complication which can come out because of this abnormal arrangement is antepartum hemorrhage. Clear? So this is how you can easily identify this. Now moving forward to next question. Here you will see we have done USG at around 20th week, and the lady is G1 P0. G is actually gravida and P is parity. Gravida means number of pregnancies. Number of pregnancies irrespective of the outcome. And parity means pregnancy continued beyond 28th weeks, which is the period of viability, right? So this is the period of viability. Coming to the case proper, this lady is pregnant, right? So we have written G1 and the period is only 20 weeks, so P will be 0 anyway. Now what is the question actually? This is the ultrasound and what we can see here. Now this is the one of the easiest questions you can have in exam. Now what you can see, look at, this is the upper part of face. Clear? So this is all face, and look at the eyes. These are the eyes here, right? So you can see that the head is absent. You cannot mark out the impression of the head, and eyes seems very bigger, and this is at times known as frog eyes. So this condition is very easy to identify, and this is anencephaly. Cephaly means skull. So and encephaly is brain, and if you add N means absent. So absent brain, absent skull. So this condition is encephaly, right? So if you look the image here, you can see the brain, the skull is absent, right? So this is anencephaly. Clear? So it's better we write encephaly. That will be a better answer here. Okay, so we can write N here. So we can remove. So this is N, and then this is encephaly, that is the brain, right? So this is a better point for you to understand, right? So encephaly, clear? So this is how we can identify the ultrasound of encephaly, right? So this is enough for this session. I am very sure you must have liked the session. So see you shortly with some more questions. Stay tuned. God bless.